You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's show, I wanted to talk about chromosomal disorders that can affect boys and girls and some of the unique characteristics that can occur when there is an issue in the chromosome and the development. There's 3 separate syndromes that we'll talk about, and we'll go through them individually. The first one is called Swyer syndrome. The second one is called Turner syndrome. And the last one is called Klinefelter syndrome. So we'll talk about Swyer syndrome first. Basically, most healthy boys and girls are noted to be boys and girls because they correlate with their chromosomes. Humans have 46 chromosomes in every cell throughout their body. The ones that determine male or female are determined as X or Y. Basically, XX will indicate a female, XY indicates a male. So all women, all girls have XX. The X or the Y that comes from the father is actually what determines whether that baby will end up being a boy or a girl. So the XY relationship is the most important part if it's going to cause that child to be a boy. But if the chromosomes remain XX, then that child will be a girl. Now, there are a few exceptions, and that's where Swyer syndrome has been noted to be a very unique characteristic. In this situation, if you do a chromosome analysis on that child, their blood type will be XY, but if you look at that child, she's a girl because she has all the external genitals of a girl, she has the physical features of a girl, and she looks like a girl. The problem is that the girl, as she gets older, may not have the appropriate development that you would expect for a teenage female, and later in life, she will not have the secondary general characteristics, such as breast enlargement, uterine growth, things like that. So what causes issues are infertility. And so if we go back, the XY, which is already present in that baby, failed to turn that child into a boy. That child stayed as a girl. What happened in the embryo as a child is developing, all embryos are female until proven otherwise. What that means is the body will assume the child is a female and develop all female characteristics until the Y chromosome becomes active. And there's a special part on the Y chromosome called SRY. So SRY is the part of the Y chromosome that needs to activate to actually cause that child to become a boy. Now, this syndrome affects 1 out of 80,000 people. So if you take a country the size of the United States, which has a population of about 300 million, you can see that there's a fair number of individuals who actually have Swyer syndrome. The difficulty is that management is not aimed at curing the disorder because those people are going to stay female for the rest of their life. However, they may need hormones in order to balance out and create some of the female features. Beyond that, those women cannot become pregnant unless they have a donor egg or a donor embryo, meaning they have a uterus, but they don't have ovaries. They don't have the ability to carry or create their own eggs, and so that causes infertility unless a specialist would step in and allow some of these new techniques, egg transplant or embryo transplant, in order to have that child. Now, the second syndrome is called Turner syndrome. Now, in Turner syndrome, the X is present, but that's it. So there's no XX, which would be a girl, and there's no XY, which would be a normal boy. This is X0. So Turner syndrome results in other symptoms and physical features that are very noticeable. So those females who have XO will have a webbed neck. It'll look as though there's webbing on both sides of the neck. The hairline will go very low down to the back of the neck. There will be swelling of the legs called lymphedema. There will be short stature, meaning those women are very, very short, usually less than 5 feet tall, and they often have other problems, such as heart defects, arterial problems, or kidney problems. The women who have XO cannot become pregnant because they don't have the features that would allow them to do so. They will actually have chronic problems, they'll have many health issues, and it's very difficult to manage that. The causes of Turner syndrome are not inherited. So what that means is you can't pass it down from mother to child or from family to family generation-wise because those individuals can't have children. This is a completely random mutation where the second X or the second Y never crosses over. So they stay XO, and that's called Turner syndrome. Now, the last condition is called Klinefelter syndrome. With Klinefelter syndrome, it will actually be an extra chromosome. So these individuals have 47 chromosomes total, not 46. And they often will have a characteristic of XXY. So then the question is, well, if they have XXY, is that a boy or is that a girl? So this will be a boy because the Y chromosome is there and the body acts on the Y chromosome instructions to create external genitals. So these individuals are boys and they grow up to be men, but they have an extra X chromosome, which causes the issues that we see in their health and development. Oftentimes people with Klinefelter syndrome, which again is XXY, they are very tall. They have a body structure that makes them a little bit clumsy. They actually have emotional issues. They are sometimes very aggressive. They have very difficult times with executive functioning, meaning they are not very patient. They act out a lot. They may have social anxiety. They may also have some developmental delays. So they're not going to be the ones that graduate from high school or college with good degrees. They're going to struggle throughout school. They're going to struggle in their jobs. And many people actually end up in prison or in other mental health institutions because of their behavior. So if you have an individual who's very tall, who is very clumsy, very socially awkward, you can see how that individual would be bullied quite a bit. And this causes aggression. And this also leads to people being incarcerated. So a lot of people who are in jail or in prison may actually have Klinefelter syndrome that's been undiagnosed. Now, the treatment is not to change the chromosomes, but the treatment is focused on managing the symptoms, which include the social anxiety, the aggression, and monitoring for the secondary issues, which include heart problems and other developmental concerns. So again, we talked about 3 different types of syndromes that are all chromosomal in nature. So Swyer syndrome, meaning that girl actually has XY chromosomes but never developed into a boy. That person cannot become pregnant unless they have a fertility specialist involved. Turner syndrome, which is XO, meaning that person cannot become pregnant because they don't have the characteristics of a full female. And Klinefelter syndrome, which is XXY. So these are boys who have social issues, physical issues that carry over for the rest of their life. So I'll have more information about all 3 of these conditions on our website. You can read the blog and get a little more content and resources. If you have a family member or a friend or someone in your school or workplace who may have one of these conditions, I would advise you talk to them and advise them to see a genetic counselor or their family doctor. Although they can't cure the condition, they may be able to offer advice and guidance on how to manage it and what they need to be expecting in terms of their health outcomes. So I hope you learned a little bit about chromosomal disorders. Give us some feedback on our Twitter page, and I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&0 Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.